thanks so much for joining this session. It's the last session of the 2 days, so I appreciate you all coming and hanging in there and seeing some friendly faces as well. So we've got the next half an hour to talk to you about culture largely and how it is a catalyst for innovation as a workforce benefit. So my colleagues and I I'll introduce myself. My name's Juliette Kumar. I am the Associate Director for Culture and Workforce at the Innovation Agency. And the Innovation Agency is one of the 15 AHSNs across England. And I'll let Charlotte, do you want to introduce?
Hiya. So I'm Charlotte. I work with Julia and Jen also at the Innovation Agency, and I lead on our portfolio for workforce.
And I'm Jen Kohan, and I'm head of our coaching academy. So you'll hear a lot more about that too.
Yeah, so the Innovation Agency has a coaching academy, and we're going to talk a bit about how we use the coaching academy to support change. And the coaching academy is really, we help people, teams, organizations and systems to develop cultures that will help them innovate and improve. And we do that by offering courses and programs, but also by wrapping what we call coach support, and that might be one-to-one coaching or team coaching around the implementation of change, and particularly complex change and working with ICSs and organizations. So, without further ado, this is, I've done it already, have I? I've broken it already. So this is what we're going to talk about. So we really want to think about how we frame innovation as a workforce benefit. So rather than innovation for innovation's sake, we're going to talk about how this it really is about workforce efficiencies and workforce benefits. Then we're going to talk a bit about culture as a catalyst for change. So we did a big piece of work with the 15 HSNs post-pandemic post-pandemic, where we looked at what happened during the pandemic and what were the cultural conditions that we saw that we could perhaps take and bring forward and keep so that we can get change at scale and pace. And then we're going to talk a bit about our complex change approach that we use, bringing all the capabilities from the Academic Health Science Network, including culture and the workforce, and also innovation insights. And then we're going to leave you with a little showcase of innovation insights in terms of workforce challenges. And that's really where we curate a number of innovations that we know are out there that could help you with some of your workforce challenges. So I'm going to, I don't know why I keep doing it. There you go.
Thanks. So I'm going to talk to you about the first kind of concept that we want to introduce, and that is the idea that innovation is a workforce benefit. Am I all right? I'm getting messages to hold this closer to my mouth. People don't normally tell me I'm too quiet, so that is definitely a first. Okay, so I'm sure I don't need to explain to anyone in this room that the NHS has a major workforce challenge. I'm sure we're all aware that, we have a major shortfall of staff. The demand for services far outweighs the capacity in which that we have to deliver those services, and obviously that demand is growing. And in my opinion, and I'm sure I'm not on my own with this opinion, I think it's probably the greatest challenge that we're facing in NHS and social care. So I'm sure, again, people will be familiar with the fact that the People Plan sets out a number of strategies for us to address that workforce challenge. Strategies around retaining the staff that we already have, or recruiting new staff to try and address that workforce gap. However, the kind of strategy within the People Plan that we're particularly interested in looking at today is around the new ways of working, and how new ways of working can actually create efficiencies for our workforce in terms of time saving, or in terms of upskilling. And that, for me, is where the AHSN Network really fit in as the innovation arm of the NHS. And so what we try and do at the network is we try and look at our programs through the lens of workforce. We've developed a framework over the last 12 months to try and understand what those benefits are that we are generating through our innovative programs. And the idea behind that is to try and create a narrative that alongside retention and recruitment and those other strategies that we're probably really familiar with, innovation can also be a strategy to address the workforce gap. Now, I know what you're probably all thinking. It's all well and good saying, yeah, you can innovate and that'll help towards your workforce challenge, but actually innovation adoption is really hard. Change is hard, and until we get the innovation properly adopted, we obviously aren't going to see those benefits to the workforce. So that is something that's really important to acknowledge, which is why Jen's going to talk to us shortly about the idea that, complex change, addressing complex change by bundling innovations, by optimizing the deployment of resources, looking at things from an end-to-end approach is really important. But first, I'm going to pass to Juliette, who's going to talk to us about the importance of culture within this challenge.
Thank you. So, yes, so I'm just going to talk about the learning, as I said, across the 15 AHSN. So we did a reset campaign across the whole of the AHSN network, and one of the themes that we looked at was culture and workforce. So taking us back, why did we do this? And we all remember this all too well, that COVID-19 catapulted us into a world of uncertainty. COVID was personal. It didn't just affect a group of people over there. It affected everybody. Everybody was impacted by COVID. We know there was a national incident declared, and the NHS really made unprecedented efforts to pivot, to address the challenges. NHS staff put themselves at the forefront of that, put themselves in danger to learn how to fight that unknown disease, the disease that they didn't have treatments for. And what we saw at that time was the NHS going into command and control structure. And we also saw technology adopted at a pace that we've never seen before. It was like there was almost a cosmic forcing function for people to start using video conferencing, remote working, all the kind of stuff that we've been talking about for years and years. Suddenly, overnight, people started to use the technology. So obviously, we don't want to live in those conditions all the time, but what were the determinants there that we can kind of take and build and learn from that we saw? So we did a piece of work on the Reset campaign. 5 of the AHSNs collaborated together to gather that information and to really do some analysis around that. We used a couple of methodologies. We used this Burbridge model, which looks at, what did we start that we want to stop perhaps or let go of? What do we want to amplify? What do we want to restart that we stopped in the first place? So we gathered lessons learned, interviewed people, we had focus groups, we did rapid insights across whole regions. A lot of the HSNs were involved in supporting that insight gathering. And we also used the iceberg model as a framework for diagnosing what was going on. And if you're not familiar with the iceberg model, it's one of my favorite tools. So it starts with what we can see. What was it that we saw? We saw rapid uptake of technology. We saw rapid implementation of remote working, for example. But then underneath the iceberg, what are the patterns? What does the data tell us? When's this happening? Where is this happening? Where is it happening particularly well? Where is it happening not very well? So we can look at data to get that trend. Then beneath that, we ask ourselves, well, what are the structures that are in place that are driving that data? So that might be people, kit, tech, estates. And then but beneath that, and the really interesting thing, is the whole system is driven by the mental models that we're holding. So we were catapulted into this situation that we hadn't been before. We all had a shared aim of keeping safe, of keeping the NHS wheels on and looking after people. So that mental model drove the system really and created the conditions. So this is a very busy slide, I'll apologise now, but there was so much great data that we pulled out of this review that we did. So if we think about what we saw rapid uptake of digital technology, as I've said, so teams attend anywhere for video consultations, virtual events for wellbeing activities, etc., and there were access barriers removed immediately by face-to-face, by going virtual. I remember speaking to a radiologist who said, because they've been working remotely and they're a profession that can do that, she said it was the first time they'd had a team meeting where all the radiologists could be there at once, and that's because they didn't have to travel site to site to get to a team meeting. So some really great stories coming out of that. I appreciate it's not all good, and we're seeing some of the ramifications of those changes now in terms of our waiting list, but at that time this is what was happening. What we saw was more collaborations. People were barriers were moved to make things happen. We saw Nightingale hospitals erected. We saw people working together. Less focus on bureaucracy and red tape. We saw clear leadership. There was a leadership structure, and people know where to go. But really, the mental model was there was trust in the system. People were trusted to do the right thing. They were empowered, and they felt psychologically safe to take a risk, to do something a bit different without being shot down or blamed or punished in any way. So that's what we kind of gathered in terms of the intelligence. So what does that tell us, And so what we really observed, if we were to refine it right down, what we observed were when we saw a rapid uptake of technology, there were leaders willing to collaborate. And when we saw good culture, there were teams who were ready to change and open to change. And when we saw good leadership, we saw empowered teams with permission to act. And when we saw people taking risks, that was because there was a presence of psychological safety in those teams. And when we saw change at pace, there were barriers removed, there was less red tape, there was less regulation. And as a leader, what does that mean for me and my behaviours? What do we want our leaders to show? What do we want to observe in our leaders? So we want them to support people to take risks by not blaming them when things go wrong and seeing things as an opportunity to learn. They want to see leaders creating safe spaces where everyone can speak up without fear. And we want to remove obstacles such as red tape. And engaging staff at the outset, as a leader, I want to engage my staff from the outset of change and empower them to act without unnecessary permissions. So, in summary, implementing change with innovation takes a threefold approach. It takes a focus on process, it takes a focus on the innovation, the new way of doing things, the kit, but without the right culture, you have a platform that will not be picked up, or you'll have a new way of working that will not be brought alive. So the focus on the culture for us is really key, and that's where we focus our efforts. And you can improve all those three elements. So I'm going to hand over to Jen now, who will give you an example of how we approach that change in the Innovation Agency.
Thank you. Thanks, Juliette. So, what's the old saying? Culture eats strategy for breakfast, right? So you can have the best strategy ever, you can have the best innovation. It's a great innovation. It's totally going to work. But if you don't have the culture in place, or if you don't have a culture that's going to be open, then you're going to be dead in the water, right? So, so what we've worked on, many colleagues, I have to say, have worked on this model. We want to share with you the model that we're working with right now that has been really exciting. We've utilized it in a couple of different ways. So it's through the lens of service redesign, but you could also apply the complex change model to different kinds of things, but this is how we're utilizing it sort of right now. And I would also say that it's not something that we came up with and we own. It's sort of a blend of several different approaches and methodologies. I'm just going to read this little bit in the middle straight out regarding complex change and service transformation, is that we can co-design a future state that improves outcomes by introducing innovations that optimize deployment of resources whilst embracing the concept of integrated care. So it's all of those elements working in concert, right? So we know if resources aren't deployed effectively. Lots of times we hear evidence of, yes, this innovation has been adopted, and then it was put into a closet and never seen again, right? Or, but someone ticked that off their list of I did my job, right? I got it in there. But we don't know anything about how it's working. Why did it get put in a closet? Why didn't anybody use it? What's going on here? So again, that's a culture that can examine that in a safe way is really important. So as Juliette said at the top, we absolutely are grounded in sort of a coaching mindset where we're not necessarily the ones with the answers, but we're here to hold space for you so that you can think through what's unique to your situation, what's unique to your pathway, what's unique to your staff complement. But we also are really grounded in design thinking, and that's a user-centered model. So it's really important that if we are asking everyone who's working in health and care to be person-centered, then we also, as strategists, as innovators, we have to be person-centered and user-centered. And whether or not that user is a staff member or a procurement leader or what have you, or in any way. We've got to think about all those components of the system. So a lot of what we hear, people they struggle to find time to think about improvement. They're like, I know what needs to be done, but I don't have a space to really unpack this. Is complex change overwhelming? Yes. I think there are a lot of things going on in our systems where we go, wow, if we could, we'd take this whole thing, we'd rip it up, and then we'd start over. But that's like undoing what's already running and in place. It's not like we can stop the presses at any point, right? So the change has to be happening in a way so that it's safe, right? Always for people. And then also we just don't necessarily know what's out there as far as innovations and opportunities. So this is where the curation part comes in. And then also we also work with folks who are like, yeah, I get it, I think it's important, but how do I talk about this? What's the language I use to help other people understand? So how do I, maybe I'm a clinician, and we've been trying this thing and it's been working, but now I have to go talk to my finance director, right? I don't know how I'm going to make that the needs clear. So the whole process that we go through essentially takes a group. Say we've done this in a couple of different spheres. I'll use PR, pulmonary rehab, maybe as a starting point, where we had a group of folks who were like, let's look at the current state of pulmonary rehab, right? It's changing a lot right now. Just the digital element, all of the, remote monitoring elements. Does everybody need to come in for an assessment in person? Not necessarily. And then we're getting to issues of inclusion and access as well, so we can hit lots of points here. We understand the current state, but we have to engage with the system in order to do that. No one can do this in a dark room of 5 people, right? This is an active engagement process. This is the user-centered part of it. The design thinking, where you empathize what's going on. How does it feel? Then we say to each other, are we all on the same page? What are we missing? How do we prioritize? Imagining a future state. What does this service maybe perhaps look like? Scanning for the innovation, scanning for the tools, scanning for the improvement methodologies. And really importantly, then we have to model ahead. We have to model what would this look like in terms of workforce. What's the workforce impact on this? If we adopt sort of a remote tool to help folks engage in their pulmonary rehab at home, is that going to free up time at the clinic so that we can see more people who have a higher risk, right? And then we want to quantify that and use some data to make better decisions. Not just, I've got a hunch that. Right? So how many people feel like you've seen changes made in your systems where somebody was just basing the idea on anecdotal evidence? Don't we all agree that? Doesn't it seem that? But if we don't really have the data, we're flying a little bit blind. Then we help develop a case for change and take that forward. So we're not implementing much at this point. There's nothing we're implementing here. That's the whole pre-part of the process that we think, in our experience, we rush through typically, and we don't really fully understand. I always hear Juliette ask this question, but what is the problem we're trying to solve? But we could do this, but what is the problem we're trying to solve? So this is a different way of looking at it, and this is really a mashup between UX, design, design thinking, and lean methodologies. And so what I like about this is what I've just described is that basically where we get to like here, right? Boop. What's the need? What have we researched? What are the insights that we're going to prioritize? Let's brainstorm. What could happen? What if? What if? What if? How might we? How might we? Right? And then we've come up with a hypothesis. If we this, then this. And this is where we go, okay, let's give this a shot. We all have come to this place. We experiment. This is like your pilot. We're going to pilot this somewhere, maybe a small service or a couple of small services. We're going to see how that goes. If we need to revise our hypothesis, we find it out then, not in the, I have an education in the States background, not after huge school districts invest in 9 million iPads for students before they did this, right? So we want to cut out waste. We want to cut out inefficiencies. Once we get to that place where we're feeling pretty good, that's when we begin the implementation process. And all these little loops, they're your PDSAs as well, right? So it's always the planning, the doing, the studying, the acting, and then what? So what I like sort of also about this is the grid here of like when we're looking for direction, we're figuring out direction, we're also looking at the challenge. When we're getting to concept and the challenge, we move over into, okay, now what's the direction for resolution? And what's sort of the concept again, because the new ideas have to feed back in. We're never done. We're never like, well, we cracked that one. It's all done now, right? So it's always ongoing. And this is where engagement can be magic, right? I think it's really important, and I'm probably getting to my time here, to say that we, as representatives of our culture and workforce team, are not the only people in our organization who works on this, nor are we the only people in the AHSN Network who work on this. And it's really a sort of matrix model that is cobbled together through lots of different methodologies. So what we try to do is, we coach people for change. Our clinical collaboration, sorry, I'm going the wrong way. We work with our other partners in our enterprise and growth team, in our digital teams, to figure out, well, given the need that we've seen, given the need that our users are saying that in our empathy, in our discovery phases, this is what we're finding. And then they say, okay, well, have you seen this? Have you seen that? Have you seen that? And then they say to other people, what do you got about this? What have you heard about that? And this is where like collective knowledge is so important, right? So once we figure some stuff out, we take those ideas and we model them against other data that we can use to make predictions. So we've used, it's not easy, that part of it. I'm looking at Charlotte because I'm like, it's not easy. We're going to make it sound easy, but that's a hard thing. And part of that, what's hard about it is the data, getting the data. So if a team is like, I don't know how much faster it is if I do it this way, well, we got to test it. See how much faster it is. And then there's all kinds of stuff that's underneath that comes back to culture that we don't know about. So, when you get down to the team level and you're talking to folks and they say, well, on average, I go through referrals at this rate, but most of them really I could kick out pretty easily because there's some major thing that's wrong with them. And then we're like, oh, okay, what about that? What's happening there? Where's that coming from? So again, this is where even feedback about experience, you have to interrogate that feedback, right? So we were finding that there were people who were doing work at sort of doing work that other people could also have helped with, and it was taking their time away from work that nobody else could help with, that only they could do, right? So those are some of those examples. Finally, we do program management to wrap around the whole thing, and then we take it to that next phase. So we sort of have design teams and then the wider communities that we work with. We also have a crackerjack PPI, patient public involvement team that our patient public involvement reps are always happy to give their feedback about stuff. Okay, so I think we've got a couple minutes left, and I'm going to pass it back over to Charlotte, who's going to give an example of how we approach this through adult ADHD diagnosis.
Thank you. So we've just got a few minutes left, so I'm just going to talk to you just a little bit about an example of this model that we've been working on over the last 12 months. So we've used the model for change that Jen's just been referring to. I'll go over here out of your way. We've moved the model for change that Jen's just been referring to in adult ADHD services. And I'm not sure how familiar people are with the state of adult ADHD services, but what we were experiencing is a lot of under-commissioned capacity in that area, really long wait times for people to get a secondary care referral. Sometimes providers stop in provision entirely because of that, and that resulted in a really high bar for that referral to ever exist. So lots of people just left in community without any support at all. So that was this current state that we were dealing with, and we employed the model that Jen just talked us through and ended up with a future state that is essentially a primary care-based service enhancement. It has 5 major changes to the pathway, which are the 5 that you can see on the slide here, one of which is a online education in advance of even accessing any healthcare providers, a new role available in primary care, a self-management platform for patients to be able to manage the condition themselves, an optimization of data transfer, so the data flows from primary to secondary care all the way through end to end, and then the kind of transition of the annual reviews from the secondary care to the primary care service without adding any burden to the GP's workload. So what I can't do is tell you about the detail of this pathway. There is a lot to it in the time that we've got now, but what I can say is what it does is it kind of increases the patient flow, it increases the patient benefits because they get access to services much more quickly, but it really drives through those workforce efficiencies, because where we were seeing a huge amount of people sat on a waiting list, we're now seeing those people being able to flow through and get access to the right professional at the right time. So I'm conscious that we don't have much time, so I'm just going to close out with a little bit about another piece of work that we're doing in the workforce space, and this is just to really try and highlight to you some of the products and tools that we have in this area. And again, it's divided up into those sections that I've been talking a little bit about. So some of the kind of more traditional technologies that you might be aware of in the kind of recruitment and retention space. So under recruitment and retention, we divide this down into 4 key areas. We look at products that help with supply, products that help with health and well-being, leadership and culture, and training and development. And this is a really interactive tool that's available on our website. And so what you can do is you can click into one of those domains, and then if you clicked on leadership and culture, you would see a whole suite of innovations that can support with leadership and culture challenges, similarly for training and development. And on the flip side of that, the other section is around optimization. And so that's the bit I was trying to get over at the beginning, that, you know what, innovation is a real workforce benefit because it helps you to optimize your workflow. And so there are loads of categories here as well where we're saying, actually, could you automate triage and referral? That would really help to optimize your pathway. What about in the workforce planning? What about roster management? And so again, if you click on any of those, you can see a variety of solutions that help you with some of those challenges underneath there. What I will do is caveat that with the comment that it is live on our website at the moment, but it is in development. So probably in the next couple of weeks, that piece will be finished. I wanted it to be available for people to have a look at if they wanted to now. So you are able to do that, but please bear with us for another couple of weeks until it's absolutely final. And so I think that brings us almost to the summary of the key points we wanted to share with you today. Obviously, point 1 being that innovation can be a workforce benefit. It can really create efficiencies and can contribute towards the workforce gap.
Yes, and the second point, talking a bit about the culture, really culture is key. Culture eats strategy for breakfast. So it's really, when you're looking at change, you're looking at complex change, a focus on culture is absolutely imperative.
And that complex change and service transformation are enabled through addressing both your culture and innovation, how you can use them together to optimize.
Yeah, and finally, just that showcase that we've just kind of whistled through there at the end of some tools and techniques that can help you to do that. But obviously, we encourage you to not address those in isolation and to address them in the kind of service models we've talked about. So just before you leave, if you do want access to any of the documents we've talked about today, the kind of insights piece that I've just talked you through, the report that Juliette referenced, the model that Jen referenced, our slides, you can scan that QR code and that will take you to a page on our website that has all of those documents available. And I can see you're all doing that, so I will leave that slide up. Thank you very much.
Thanks.
Thank you.